Good afternoon guys and welcome back. My name is Kris and today I thought I would walk you through a couple of the contraceptive options available for women at the moment here in Australia. If you're interested in finding out what the options are, how they're done and why they work, stay tuned. So this is actually the first of a mini series I'm thinking of doing, which is giving you the spiel that I give my patients. So if a young woman comes in and wants to talk about her contraceptive options, obviously the advice I give her is very much tailored to her sexual needs, her medical needs, and her contraceptive needs. But there's always a basic spiel I give everyone, which I thought would be interesting to share. An obvious disclaimer here, the advice that I'm about to give is general advice and may or may not be applicable to yourself and your own circumstances. So if you have any questions about contraceptive options for you, please see your own GP. When it comes to contraception, I like to start with only one method is completely foolproof when it comes to preventing pregnancy, and that's abstinence. A patient of mine has also recently asked me to put into my spiel that being with a same-sex partner is also a 100% foolproof method of preventing pregnancy. So I thought I'd throw that in there for you. So aside from abstinence, the methods that we talk about include the short-acting and the long-acting contraceptive options. Quick little side note, contraceptive options for females are categorized in one of three ways: combined, progesterone only, or barrier. Combined contraceptives have both estrogen and progesterone in them and work in a slightly different way to your progesterone only. And of course, barrier methods include things like condoms and dams and things like that. But again, we'll get there. I like to start from the most effective to the least effective, so that's how I'm going to go through it now. And your most effective option, aside from abstinence, as we just said, are your LARCs, or your long-acting removable contraceptives. The most effective LARC on the market at the moment is known as the Implanon. I believe in the US and other countries it's also called the Nexaplon or something similar. But the Implanon is a progesterone-only contraceptive, which means that it does not contain the hormone estrogen. The Implanon is a 4 centimeter very flexible rod impregnated with progesterone, which is inserted into the arm here. When we insert it, we measure 8 centimeters away from the bony part of the elbow, away from the bicep crease here, so it doesn't get lost. So it sits around here. Once inserted, the Implanon gives you a 99.95 to 97% effectiveness at preventing pregnancy and can stay in situ or in the arm for up to 3 years. The benefits of the LARCs, like the Implanon, is that you don't have to do anything. Once I insert it, you're done. It's effective immediately, especially if inserted during your period. And as soon as you remove it, it is now no longer effective. I will very briefly touch on side effects because a lot of these will vary, but the side effects a lot of women have with the Implanon is that they have irregular bleeding, especially for the first 6 months of its insertion. But ask your doctor if there's any way that we might be able to reduce this, prevent this, or circumnavigate this. The second most efficacious method of preventing pregnancy using a LARC is known as the Mirena IUD. The Mirena IUD is a coil that sits in the uterus itself. It is again about a 4 centimeter very flexible umbrella shaped device that we insert into the uterus via the cervix. Like the Implanon, it is a progesterone impregnated device. Every time I say impregnated, I giggle a little bit. And this can last up to 5 years. The benefits of having the Mirena over the Implanon for some women is that the effects are more localized, meaning they affect mostly the uterus only and aren't systemic or throughout the whole system. So side effects such as pimples, breast tenderness, and other things like that due to progesterone are usually reduced in Mirenas. Of course, you can imagine that inserting into the uterus means that this is a more uncomfortable insertion process, but it's not necessarily painful. There is a rumor that I've heard several times myself that if you've never had a child, you are not eligible to have the Mirena, and that is false. Completely and utterly false. I have inserted Mirenas in people who have had 4 kids and who have never been pregnant and everything in between. The insertion process is easier if you come in during your period, and of course your doctor will walk you through why, but essentially the cervix is the little entranceway into the uterus and is where we get our smears done, or our pap smears, now known as the cervical screening test. It's got a very tiny hole in it that we insert a device to measure the size of your uterus, because you need at least that, I'm usually comfortable around 7 to 8 centimeters to insert the Mirena into for it to float around in. If we have difficulty inserting this, we may use something called a dilator to open up the cervical passage itself. But if you've not had children before, or you've never had a birth vaginally, this may be quite difficult. In this case, some GPs may not be able to insert it and may refer you to a gynecologist to insert whilst you're under anaesthetic, so you don't feel as we dilate the cervix. It sounds brutal, but there is a reason for everything we do. Just like the implant, once we insert it, it is effective, and once we take it out, it is no longer effective. Now, next on our lunks is kind of a debatable one, whether it's a long-acting contraception or a short-term contraception. It's up to those with higher pay grades than I to decide, but it's the Depo contraceptive shot. So the Depo is again a progesterone-only contraceptive that is injected into your muscles every 3 months. Unlike the Mirena or the implant, this is not something you just set and forget, as you do have to come in every 3 months for your injection, or 12 weekly. Yes, 3 months, 12 weeks you think would be the same thing, they're not always. The positives of the Depo, of course, is it's only every 3 months. It's one needle, it's not something sitting inside of you. But the negatives are that the Depo is one of the only contraceptives that can still have a long-lasting effect even after your last shot. When we walk someone through getting the Depo, one of the things that we endeavour to tell people is that it can take 12 months after your last Depo shot before fertility returns to normal. This means that if you are wanting to try for a child, you may have your last Depo in January, be due again in, say, March, but not be able to fall pregnant until the March afterwards, and that's within the realm of normal. If you are wanting a contraceptive option that you could just stop and then be able to fall pregnant, perhaps the Depo isn't for you, but again, this is a conversation between you and your doctor. The Depo contraception is approximately 94% effective. Now, I would be amiss not to talk about the non-reversible surgical methods of contraception, including the vasectomy and the female sterilization. Vasectomy is where the vas deferens, which is the cord that carries sperm from the testes out of the penis, is cut so that you can have your normal function, but sperm cannot travel through the hose, as it were, to then go inside a woman, meet the egg, and babies are born. Female sterilization works in a very similar way, but is a much more difficult procedure, because whilst the vas is very easily accessible from the scrotum, the fallopian tubes, which are the tubes that connect to the ovaries to the uterus, are not easily accessible, and you do need to have laparoscopic or open surgery to find these. Whilst a vasectomy is a very simple procedure that can be done in a GP's office. Both of these are considered to be very effective, but shockingly not as effective as the Mirena or the implant. Alright, now we move on to your short-acting contraceptive methods. This includes the pill, as it's known, which is typically the oral combined contraceptive pill, and the mini pill, or the progesterone-only pill. It also includes things like a patch, a NuvaRing, and condoms, and other variant methods. So the pill. When we talk about the pill, typically this is the one that contains both estrogen and progesterone. You take this once every day at approximately the same time every day, and you've got about a 95% chance of avoiding pregnancy. In a typical pill packet, you'll have 21 days of active pills, which have progesterone and estrogen in them, and 7 days of sugar pills, which contain lactose. Note, they do not taste like sugar, unfortunately. The whole point of this is to allow for a withdrawal bleed. So the 7 sugar pills are the pills that you take to induce a period. Mind you, it's not a period in the sense that you've had a big FSH and LH spike, ovulation, and so on and so forth. It is a withdrawal of progesterone and estrogen, if you're using the combined pill, that tells the body, oh, we didn't get pregnant this month, I guess we're going to shed the lining. The positives of being on anything with progesterone is that your periods can be lighter and less frequent almost to the point where you might not have a period, such as people with the Mirena. So the vaginal ring or Nuva ring is something that you insert into the body and is about 91% effective at preventing pregnancy. My understanding of the Nuva ring is that it's a method that you put in for 21 days and remove for 7 days to allow a withdrawal bleed. However, I will admit my expertise here is quite minimal, and I'm very happy to look into it if you want a more in-depth explanation, but it's not very common on the market. I suppose now is a good time to kind of talk about how and why estrogen and progesterone work to prevent pregnancies. So the common thing you would have noticed by now is progesterone is in almost all of them except for the barrier and surgical methods. The reason this works is progesterone is a very potent hormone at controlling our cycles and our linings. So to have a pregnancy, you need a lot of factors lining up, which is why it can be quite difficult for some people to fall pregnant. You need to have ovulated, and the menstrual cycle and ovulation is a very complex topic that I will not cover today. You need to have a lining in the uterus for the sperm and the egg to meet and then embed into. You need to have a sperm, and you need to have a certain amount of leeway for sperm to get in through the cervix and into the uterus to meet said egg. So progesterone works by reducing the thickness of the lining so that if sperm and egg do meet, they can't embed. Thickening the cervical mucus. So thickening the cervical mucus means that if you do have unprotected vaginal sex with a man, the sperm cannot get through the uterus, the cervix as easily into the uterus, and therefore the chances of egg meeting sperm is much lower. Progesterone also can prevent ovulation, so you don't release the egg to begin with, but this is one of the more unreliable ways that it works. So you can have reduce in ovulation, reduce in thickness, and increased difficulty with sperm to meet the egg. So that's the progesterone. As for estrogen, estrogen works very synergistically or hand in hand with progesterone to reduce or stop ovulation. So based on this, you can see how the pill and the mini pill work very similarly but differently. And the biggest caveat for a lot of women is that the mini pill is the pill that has to be taken at the same time every day. There is about a 3-hour window, so if you normally take it at 6 a.m, you can take it from, 4:30 to 7:30 in the morning, but it has to be taken in that window. Otherwise, the risk of pregnancy increases quite quickly. By the way, when we talk about how effective something is at preventing pregnancy, this is by perfect use. If you miss pills, if your implant's not inserted properly, if you don't put on a condom or you put it on incorrectly, these values will differ significantly. This is why, yes, the pill is 95% effective, but people quite commonly will say, but I fell pregnant on the pill or whatnot, or I know someone who did. And that's because it's not used properly. I think it goes without saying, but I will talk about it. Barrier methods are a method in which either the penis or the vagina entrances are covered so that sperm cannot come out or sperm cannot come in. These are much less effective, but are the only method that I've mentioned that prevent STDs. So please consider using a barrier method not only to prevent pregnancy, but to stay healthy. If you are using both the pill and a condom, your chances of getting pregnant are much lower than one or the other, and the same goes for your LARCs as well. Now, I will not go into detail today about the non-medicine methods of fertility awareness, such as the withdrawal method and the timing and the mucus and the temperature methods, though they can be useful, especially if there is a very good reason why you can't be on a hormone-based contraceptive. But again, that's a video for another time, and if you're interested, I'm very happy to look into it and to formulate a video for you. To recap, the methods that we've got that prevent pregnancy the most include abstinence, having a same-sex partner, and then your LARC method. So your long-acting methods such as the implant, the Mirena, and then the Depo. Your everyday methods such as the pill and the mini pill are relatively effective, but require you to do something every day to prevent pregnancy. Then you've got methods such as the Nuva ring and condoms. Only condoms and abstinence can avoid STIs, so please look after your sexual health as well as your fertility. And if you have any questions, let me know, but more importantly, see your own GP. If you'd like me to go through any of these in more depth, let me know. I have experience in prescribing almost all of them, except for the Nuva ring, obviously. I stuttered the whole way through that part. But I've also inserted and removed implants and Mirenas, so if you want my perspective on all of that, let me know. Until then guys, stay safe, stay healthy, and I'll see you in the next one. Bye.